When I get patients in for general checkups, wellness exams, I feel that the best service I can give is to make sure that the person I see during the exam is the person that makes it to 90 years of age without much disease, without many surgeries, and with as little medicine as possible, and also little suffering as possible. The truth of the matter is your average American is usually overweight, hypertensive, stressed out, and doesn't sleep properly. So even if my patients come in and I give them my questions to figure out where they are, and they say that they're relaxed and not stressed out, they're eating properly, they exercise all the time, even if I hear those answers to the buzzwords, I will still have to investigate further, especially if I hear the answers, but yet I see somebody that's obese, I see somebody that's biting their nails, I see somebody with hair falling out, I see somebody with a bad relationship when they come in with a spouse or a child. So it always deserves further investigation. Now there's a small percentage of patients that do fit the criteria. They are eating properly after investigation. They are practicing some form of relaxation therapy or meditation. They are exercising and moving, and that's fine. When I do hear that, I give them a blessing. I say, come back and see me, or come back whenever you need me. But your average American isn't that way. So it's always a challenge to figure out how can I find the weaknesses and the strengths in this individual, and then how can I help that individual or empower that person to understand what's missing and work on it. So the reason I'm talking about high intensity interval training is that a lot of people understand exercise as what they were taught as exercise forms when they were younger. Most of us, when we were moving, forced to move, was usually high school. You're forced to participate in physical activity or physical education. And that's usually where the bulk of the introduction of exercise or movement comes in. A lot of us don't remember what we used to do when we were in grade school or kindergarten. That's when we were running everywhere, and that's when we were healthy. Wouldn't you like to be back at the times when you would just be able to run all day, play outside, go to home, go to sleep, and then sleep for 10 hours straight without even waking up? That would be great, but most Americans can't. And the reason is multifactorial, but just sticking with the exercise portion of our talk now, if you only know volleyball, or if you only know weight training and football, or if you only know basketball, that might be a little limited in what you can use to venture out there and develop some form of sustainable exercise routine. Now, not all of us that are parents working in dual income households, 50 hours a week, also taking care of kids, putting some kids through college, not all of us can afford 2 to 3 hours of exercise every day. You know, I had a trucker yesterday that came in for a DOT physical, and he told me he worked out 2 to 3 hours a day. Now, to attain that mental readiness for exercise, he'd have to invest in a stimulant. So he'd finish his 10-hour workday, he'd have to put down some form of stimulant, whether it's a Red Bull, something of that matter, or a stimulant exercise pill that you get from GNC or Vitamin Shop, or some other form. He still had to rob Peter to pay Paul. Now, if you're taking stimulants in the evening to exercise and getting a buzz from the exercise and then coming home, there's no way, most people can't get good sleep. Number two, if you're taking stimulants, usually there's a side effect of stimulants. The stimulants don't stop when you say, okay, gotta go to sleep now. They keep on, and there's residual symptoms that you'll feel after the stimulant has been ingested. People that take coffee in the afternoon, at noontime, can be overstimulated by the time 12 midnight comes. We have many people that have insomnia from the stuff that they took in the morning. So if you're investing in something in the evening to supposedly get you healthy and exercise, that's probably not the right kind of exercise that you should be investigating or investing in. So in regards to my DOT guy, I tried to suggest maybe at his age, if he wanted to beat the weight that he was trying to work off, or bring down the blood pressure that he was showing massive amounts of high blood pressure, then maybe number one, stay away from stimulants. Number two, change around to 2 to 3 hours of workout of bodybuilding or powerlifting movements to more of concentrated amounts of maybe 20 to 30 minutes maximum of just high intensity exercise. The basic formula when I was growing up in the 80s, 70s and 80s was you take your age and you subtract that from 220, and then you take 60 to 80% of that number, and that's the goal for how high your pulse gets during your 30 minutes to an hour of exercise. That's 60 to 80% of your maximal heart rate. That's kind of like a good way to remember to keep it to a certain interval so that you're always working to keep it up, but you're not overworking. Truthfully, since mixed martial arts, since a lot of our endurance athletes have pushed the envelope with ultra marathons, ultra events, even some of the exercise routines in some of my mixed martial arts gyms, these guys are really pushing the envelope, and they've shown that you can go past that 60-80%. That's where I believe the high intensity training from the 70s and 80s went on to high intensity interval training now. And it's essentially taking a block of time, warming up, hitting an exercise routine, maintaining an exercise routine and a heart rate, decreasing it slightly, bring it up again, decreasing it slightly, bringing it up again, and then either 2 more intervals of that or just winding down. Winding down could be in some easy 60% of your maximum heart rate exercise, or some easier cool down exercise. But that's the concept. You'll find different definitions over the internet, but the concept is just that. You build up, you maintain, decrease, decrease, and then you cool down. The HITs, or the high intensity training from before, used to be just go all out, exercise, push the envelope with your heart rate, try to get through it, and then you're done. But we found that decreasing and increasing, the hills and the valleys that you'll hit, usually will actually train the muscle, train the heart, get better endurance, and have the lung able to extract oxygen in a more efficient way than the other way, the old way, HIT. So look up your different definitions, but the idea is to know what your limits are. If there is heart disease, if you're a baby boomer, if you're in your 40s and 50s and haven't exercised, going straight into HIIT suddenly would, if you're not cleared, either bring out a quiet heart attack that's been cooking for a while, bring on a stroke, get you injured, and then you're going to probably fail or be stuck in a cast or a splint for a short amount of time. So the idea again is to get clearance. If you get clearance from a doctor that's invested in kind of getting you to 90 years of age, then we know how to get there slowly, efficiently, without any suffering, and then keep the gains so that they're sustainable and that we love them. Not everybody has to invest in. I like combat sports, I like contact sports, I like yoga, I like meditation. I like hiking. I lead hikes in our national parks. That's not for everybody. But I think it's at least what I love to do, and through what I do, I can show people how I invest in keeping my health at a certain level so I can hopefully get to 80 to 90 years of age with as little suffering as possible. Now, if you take the way I package my life and live it, then you hopefully will be able to find what resonates with you. Again, if you can find some form of high intensity training and then use it in intervals, then there you go. You've found what you can do. In addition to getting out to nature, in addition to finding some form of relaxation therapy or relaxation exercise, yoga, tai chi, hiking, and then incorporating a mostly plant-based whole food kind of nutrition or diet, I think those are the formulas, or those are the stepping stones and the ground frame for developing your own form of exercise. Now, I mean your own form of longevity. If you already have medical problems, then definitely have to get to one of either me or through DrRic on demand, wherever you are in the world, or one of my friends, one of the other integrative medicine doctors that have graduated from the Arizona Center for Integrative Medicine, Or if you're in an area that you can't, that's a little limited, then you go to what you can and get the best information that you can that's reliable. But now with the internet, and that's what I do with DrRic On Demand, I am able to communicate via Skyping or just through the internet with people that don't live in the area, so they can take advantage of my knowledge base. But that can be with most of my colleagues that have graduated with integrated medicine, and my other docs, colleagues that have worked with the sole purpose of getting the best or maximizing the best out of their patients, whether it's with medicines to stabilize disease or with eating, thinking, and activity as a grounding frame for improving the outcome of the medical problems, even if there are surgeries or medicines involved. Bottom line is there's a mix of different things that come together to make a lifestyle that is sustainable and a lifestyle that gets people to 90 years of age. It just depends on accessing that information. There's a lot of good stuff out there. There's also a lot of bad stuff out there. So you have to have somebody of an advocate to help you figure things out. Just be wise, have the intention of what you want to achieve, and don't settle for where you are right now. Always strive to get things moving and keep things brisk and new.